Hello everyone, this is Doug Nelson, the founder of Precision Neuromuscular Therapy. My goal in this and subsequent videos is to provide you, as a client of a precision neuromuscular therapist, a deeper understanding of the work that your therapist will be doing. Precision NMT is focused on helping you achieve your therapeutic goals, and these videos will help you understand that process. It's our view that the more deeply you understand the intent, process, and purpose of the work, the more likely you will be to benefit from precision neuromuscular therapy. This video is meant to be a guide for your first precision neuromuscular therapy session. At its essence, precision neuromuscular therapy, or PNMT, is really all about problem solving. We can do more general kinds of work, but at its heart, what we're really best at is solving problems. When people come in with a specific issue like neck pain, back pain, foot pain, that's when we really shine. That's when the work is really at its best and at its essence. And because it's about problem solving, certain things about the process are really, really important. Assessment is really the key to problem solving. So your precision neuromuscular therapist will do many kinds of assessments during the session, including, for instance, movement limitations. If it's a neck issue, for instance, your therapist might ask you to move your neck in multiple directions to find out which areas are difficult for you, which movements are difficult, which movements are very comfortable and actually might provide a measure of relief. For the therapist, all those pieces are really important because that will help us identify the underlying causes of your discomfort. In addition, another assessment is the tissue texture, the therapist actually palpating the tissue and seeing what it feels like. And thirdly, yet another one is the way your tissue responds to that. It's not only how we feel, what we feel in the tissue, but it's also how your tissue then responds to that intervention. All of those things are very meaningful, and that's just three things, but there are many more kinds of assessment that your therapist will be doing, some of which are a little more formal and you'll be very much aware of. Many things during the session, the therapist is assessing things you won't even know about because it will just feel like treatment, and that's as it should be. To really create an effective treatment, which is no small thing, we really need very clear communication. So the therapist needs clear communication from our client. And that is really important for you to understand. There are some types of work, and it's really wonderful, where you go in and you just kind of zone out and there's no talking. But this is not that. To truly problem solve, we need feedback from you to understand how you are responding to the treatment. It's very different than some other modalities. Your feedback is crucial because we as a therapist know what we feel, but we do not know what you experience. I think sometimes that's difficult for clients because if the therapist is very skilled, the client has the sense of, you just seem to know where to go and you just seem to know what's going on. Actually, we can feel some tightness in the tissue, something that draws our attention, but we really don't know how your nervous system responds to that. We would only know that through your telling us. So it's really, really crucial that you do that for us. Because in essence, precision neuromuscular therapy is all about precision. It's all about targeting the right spot, the right areas. And it's really about that focus, not about pressure. So one of the things that I've always taught my students is, if the client says, maybe if you pressed a little hard, that's really code for it. That's not the right area. Because when you're exactly on that right area, it is compelling. It will get your full and complete attention. And that's really what we're looking for. Nothing less, actually. And for those of us therapists, sometimes it's just the turn of a wrist. Like as you see in the picture, if I just pivot my wrist just a little bit or change the angle that I'm approaching the tissue, it's the difference between sort of, kind of, and oh my goodness, that's the spot. So these aren't big motions oftentimes. Once we focus in, we need your guidance. And if you tell me, you're close, but if you just go just a little bit north and then try to pivot, we can't express enough how helpful those directions are. Because honestly, I'm not sure we would ever feel that. I've been doing this for more than 40 years. I still need that direction from the people that I see. This is also really important because each spot has its own sort of qualitative thing, the quality of what you feel. The two questions that we always ask are, does this feel relevant? We can find something that is really sensitive and your brain, your nervous system knows, yeah, it's really sensitive. Honestly, that has like nothing to do with anything. That's really important. And again, we might not know that. It's a mystery to everyone how your nervous system knows kind of hurt from harm, so that when we press on something in some way to you, it feels like, oh my goodness, that's sensitive. And the second part is, I've been waiting for X amount of months or whatever to have somebody be right there doing exactly what you're doing. There's something validating about being exactly in the right spot. How your nervous system knows the difference is still a mystery, but the only way that we would know that is with you telling us. And the second thing is, does this feel productive? So it could be the way we're approaching it. So if we're holding pressure and you would like more movement-based things, or if we're moving and you feel like, if you would just hold that spot, maybe that would be better. Let us know that. Sometimes, again, we can be on something and your brain will know, that doesn't feel like that's the right approach to this. Let us know, because a precision neuromuscular therapist has many possible ways to approach any specific area. So we'll ask you to compare. What does it feel like if I do this? How about if I change it and do it this way? What do you feel? And your nervous system somehow will know, oh, you know what? That's a really good way to approach this. So is it relevant? Is it productive? In the end, precision neuromuscular therapy is really a partnership between you and the therapist. It's that communication, that partnership that really makes it rich and will ensure that the results are exactly what you hoped for. Thank you for taking the time to watch this.